I'm Dr. Mandy Kirk from Move to Success Physical Therapy, and today I'm going to be going over some exercises that should help with lateral epicondylitis. So lateral epicondylitis is inflammation and pain that's right on the outside of your elbow here at the lateral epicondyle. It's also known as tennis elbow, but it doesn't necessarily occur just because you've been playing a lot of tennis. Any kind of repetitive motion can cause this inflammation. So a couple exercises that I like to give people that are super basic. If you have a weight at home, you can use it, or if not, you can just use like a soup can or something else that has a little bit of weight on it. And because lateral epicondylitis can cause forearm discomfort and pain as well as just at that spot on the elbow, I have people bend and hold at the elbow here and then just go up into flexion like this. So 20 is usually my magic number. For lateral epicondylitis, I tell people maybe break it down into sets of 10 and do 20 to 30. So do 2 to 3 sets of 10 depending on how it's feeling. Everything is always based on comfort level. If anything is sharp, then we stop. We don't go past the point of pain. So a little bit of it hurts so good, or this is a little uncomfortable, that's to be expected. But anything that's sharp is when we terminate an activity. This is something that you can also do while sitting. You can rest the elbow on a table and still perform that wrist flexion motion going up like that. And then after you're done with that, you're going to flip the palm and go up into extension. So the first one we did was flexion. Now we're doing extension. Again, 2 to 3 sets of 10. You can again rest the elbow on something to give it a little bit more support. If not, then keep the elbow tucked in really close to the body, and you can stick a rolled towel underneath and kind of pinch it in like this to hold, just to remind you to keep the elbow in nice and close. And then finally, pronation and supination is flipping the palm up and down like this. And this is something that you're really going to feel right here along that lateral side of the forearm. So again, 20 to 30 each direction of this exercise. I also like to give people a tricep stretch when they're starting to feel pain in that lateral epicondyle region, just because the triceps could also be getting tight on the backside here. So bringing your arm up and like you're going to reach to touch your back here, and then pushing a little overpressure through the elbow with the opposite hand. Hold for about 20 to 30 seconds. So you're going to need to hold for at least 20 seconds to let the muscle fully relax. And then bringing it back down, do 5 times on that affected side. Another really good one is taking a towel and doing towel twists. So this is working those forearm muscles as well. Again, not going past the point of pain, so twisting down and then flipping the palm, going the opposite way, twisting up. And then I like to give people radial nerve flossing that have lateral epicondylitis pain. So the radial nerve kind of crosses up and over here and then goes down the front of the arm. So it's close to the lateral epicondyle. It's not exactly right on it, but a lot of times if muscles down in the forearm are getting tight, it could be pinching that radial nerve, and you might get some shooting pains, numbness or tingling down the arm. So I like to give everybody this exercise that has lateral epicondylitis to work on. So this is just a really easy way to kind of floss the nerve back and forth. So nerves don't stretch, but they can be flossed back and forth like flossing, to kind of break up the sticky spots of where they're getting stuck underneath tight muscles. So with the palm up, you're going to be going up, and then you flip the palm when you get to the top, down, and going back down. And you can bring your whole body into it. So up like this, and then palm flip, and then down and up and down, 20 to 30 of those as well. So if you have any questions about these exercises for lateral epicondylitis, feel free to contact me via my website, movetosuccesspt.com, or you can find me on Facebook, Move to Success Physical Therapy. As well, like and subscribe, and feel free to comment on the YouTube video as well to ask questions. Thank you so much.